Um, Hi, I'm David Chavis. I'm with Community Science. We're a research and development organization that focuses on community and systems change in order to promote healthy, just, and equitable communities. I've been a student of community change for a long time, have staying power, as we were talking about earlier. So I'm happy to share this stuff to you. But first I wanted to say I recognize and I appreciate the difficult work you all face. And however, you know, the three most difficult things to do, you know what those are. One of them is climbing a mountain that's leaning toward you. The second one is kissing somebody who's leaning away from you. And the third one is talking about evaluation after lunch. So then community change is number 4. Okay. I wanted to start. I promised story when I was so I'm gonna, as a true evaluator, I'm gonna tell you, feedback everything that you already know. So here I go. When I was a faculty member at New York University, the psychology department was split between the physics department and psychology. There was no walls. So a bunch of young professors would meet, you know, we got to know each other as our community, and we'd have lunch in, you know, the West Village. You had a choice to get any food in the world delivered. Over the year, more and more people started coming to it, the senior faculty, MacArthur Fellows, Nobel Prize laureates, Jack Cohn, some of you might know, statistician, would sit there and they'd talk about what they were doing. And the quirks and all the stuff that I didn't understand, and I did what everybody called the community stuff. So one day they turned to me, David, you talk about everything, but you never talk about, like, what do you do? And I explained the community change. And the physicist, Nobel nominee, he was only nominee, said to me, wow, that's complex. So it was a very important lesson. First of all, we know the difference between hard and soft science. Hard science stays the same over 1 billion years. Soft science, our world, okay, it's constantly changing. So my first point is, to quote Lee Shore, we have to first embrace complexity. I totally agree with what Kerry was saying. We can't overcomplicate it. We have to learn how to deal with it, though. We can't walk away from it. It is complex. The second thing is that evaluation is never better than what it evaluates. Strategy matters. And for evaluators, they have to understand the strategy of change. You must have done the greatest fitness program evaluation, a curriculum development program, but when you're looking at community change, it's different. It's a different methodology of phenomena. If you don't understand the strategy and what works, you're not going to do a good evaluation. Okay? And as somebody said earlier, and I just applaud that, community change results from changing systems and environments, not programs. Programs are important, but it's the relationships and the other changes that make a difference when you're talking about population level change, helping everybody equally across the board, all communities, not just some. So I want to share with you some lessons learned from this process and over studying different community change initiatives over the last few years, several years, and also comparing what seems to have been working across those. So when the question is, what do communities value? I thought that was a great question to open this up. I think we have to remember that community, in my experience, communities value inclusive decision-making processes, not just listening to what they say, but they have to see that they've really made a change, that their input made a change, made a difference. So that's really talking about power and change, not just saying, thank you for coming to our meeting, we'll go back and decide what's going on. But it's truly, we have to embrace power as well as complexity and changes in power in order to be able to have change at the population at the larger levels. Okay? They also value achieving results. Now we all do, but it's the results that we promised. One of the things that I found is that many programs are launched with very good intentions, with brainstorming sessions, but they're really guesses. People are being experimented on. I have an idea, a funder has an idea, a group of community groups come together, community leaders come together, they have an idea. Never looked at what knowledge is based, what has been tried before, but they're going to do it because, hey, it's our idea. Now think about it, if that was a medical practice, for those of you with medical, if you went in and your doctors got together and say, hey, I saw an article in the paper yesterday, I got a brochure from this guy in somewhere who says that this thing works, let's go try it on a few people. Malpractice. But we do that every day in our work. And so there is a body of literature. We don't have to start from scratch. We don't have to start from a blank flip chart board, that we have to do our homework and be knowledgeable. And that leads to results. And people expect that. We have a covenant with people to know before we go in, or else we're no different than the medical practitioner without a degree practicing. The second thing is everything must align. If there's three things that are most important, I say alignment, alignment, alignment. Okay? What you're doing has to align with the outcomes. So both strategy-wise, but also your evaluation. If you're going to have changing environments, then you have to look at changing environments and relationships. Okay? You're not going to get to outcomes initially when you do community-level change. It's going to be looking at those changes first. So we're going to have to begin to make sure that both our measures align as well as our strategies align. Thirdly, the level of change must be appropriate. Strategies and evaluation must be appropriate to the levels of change. If you're changing so that the types of changes may not be at the individual level. There may be changes, and if you're doing community changes, as people said today, there are going to be changes in relationships, but there's also going to be changes in policies and structures and how systems function. It's important, if you're doing community change, yes, it's great that everyone loves each other in Spartanburg that's on the committee, but do the institutions work together better? Are there policies changing that create more equitable access? So at both levels, individual, the organizational, and the community level needs to be addressed in your evaluation design as well as your strategic design of that. Next, we need to have powerful strategies. The question that daunts a lot of evaluators, including myself, is what is the dosage strength, to use that thing? How much do you need to move the needle? Okay? And so measuring that becomes very important to think about it. If it was a fidelity, I'm not fidelity, but to say that how many times you need to be treated, how much community change, how many people need to be involved, okay, in order to be able to start moving the needle. And I'll talk a little bit about that in a moment. But that's very important to think this. Does our strategies, are they powerful enough to make changes at the population level? If programs are working with 50 people, okay, and they're great programs, the strategies involve group of young people of 300-400, if you have 10,000 young people, that's not powerful enough. It's good for those 10 or 50 or 100, but they may not move the needle, okay? If it's just one little change, it's not going to make a difference. We talked about all the stuff that, what was the group that you're working, Vanguard? Voyagers, so the V. The Voyagers was doing, that was a lot of stuff. That was powerful. It wasn't just one thing. Media, organizing people, different things came together to begin to move that needle on crime, relationship building. So we need to be able to do that as well. Some more lessons. I really like one thing that Mitch said that doesn't get talked enough at these meetings, which is that we talk about the community as this monolith. This is one thing, the community. We are never working with the community. We are working with many communities. Spartanburg, Niagara Falls, all of you have many communities within it. And not every boat is being lifted equally. So if there's no justice, there is no results. If everybody isn't being lifted up, if there isn't equity of access and opportunity, not only do the schools have to be able to teach and kids have to be ready through schools, but there has to be opportunity for employment if there's going to be that. There's got to be opportunity for access. Important strategy, but evaluators, as part of our accountability, need to be measuring that too. Not just test scores, but even if the kid does well, will he or she get a job? Will he be able to get to a four-year school? Is there access, equal access? So very important that we realize that when we're talking about community change, we are talking about issues of justice and addressing inequalities. Okay. Next, I would talk about context matters. And it's odd for evaluators because usually we use context, and I'll do it in a chart too, it makes the same thing. It's that stuff we circle around everything, all the other stuff that we're doing, right? We have to recognize context. But in community change, not only do we have to evaluating it, not only do we have to identify and account for context, but we also have to look at how context changes. Changes naturally as a counterfactual, as well as changes because of the work that we do, because we are changing context. So evaluation has a very, very difficult challenge with that, and one that has to be accounted for, not as context is passive, but context is dynamic, and it has to be part of the evaluation strategy. The next thing I talk about is the three things, and I can unpack them for you if there's questions later. What differentiates most in my mind of evaluation as well as strategy is being able to address three important factors. Scale, okay, how much, are you reaching enough people to turn the needle? Is what you're doing hitting enough people? Not do you get everybody, but in fact, I'll say now that do you hit that tipping point, okay, where things begin to move on its own? So I think one of the measures, and I can glad to do that, is to look at the work on tipping point. Some interesting literature that we don't measure that. What is that tipping point that's going to change a school, change a neighborhood? We know some things, and others have to be investigated, because that's the point we're looking for, the point where it begins to turn on its own. Okay, that's where scale. Many talk about scale as being replication. Replication of programs is not going to achieve that. There'll never be enough boys and girls clubs on every block. We will have a health worker, but that health worker may not be a community health worker. It might be your neighbor. There's lots of them. Okay, those get enough of that, and that begins to, health information begins to move. So we have to start thinking about what are those things that create that tipping point for change. The scale. Sustainability. Sustainability is only partially money. As again, someone said earlier, it's not about money. Money, this foundations come in, government comes in, drops a lot of money, they're not sustainable. Things are not designed for that way. My first job really was with the Stanford Heart Health Project, because in year 4 of year 5, when they gave, I think it was about $500,000 per community in the Stanford Heart Health Project, and they wanted them to continue because they got such great results, and those small cities that everyone in these small cities, where do we come up with $500,000? And that was in 1988 dollars, so it's a lot more now. So where's that going to happen? How are you going to make it sustainable? How do you build it into what I think is more important are the habits and institutional practices. How do you make it, institutionalization is a habit. So how do we build it into the habits? Not how do we just fund it, but how do we make it the way our business is done in our communities, at the community level, at the organizational level, as well as the individual level. So it's institutionalization is really the bigger word, okay, of being able to make that into a habit. And thirdly, and I think most important, a word we all throw around but don't spend enough time with, is the word capacity. We all know the phrase, you know, you can give someone a fish and they can feed him for a day, but if you teach them how to fish, they can feed themselves for a lifetime. But we really don't do that in our training and technical assistance capacity building. We don't make it sustainable. We don't make it something at scale with those skills, those capacities, both at the individual and organizational levels, and that's part of it. Sustainable, scalable change requires that institutions and individuals, as well as among organizations, have the capacity to manage and address the problems in their communities on an ongoing basis. Because one thing you know is stuff happens. So today it's one crisis, tomorrow it's the next. You know, how are you going to deal with that? You have a vision. How are you going to get there as stuff does? If you don't have the capacity to be able to manage and control change as institutions, both collectively and individual institutions, then you can't maintain the changes that you occur. So these are all measurement issues. Don't, you know, it sounds like I'm talking about strategy. I'm talking about both. Can't separate it. You have to do it, and you have to be able to measure it. And that's what I'll talk a little bit about, not to get caught up in the details of that. And lastly, the other lesson we learned from studying a multitude of these community initiatives and what lasts and what doesn't is that to develop a culture of learning, of data and knowledge-based decision-making and accountability. I'll say I added that just a moment ago after hearing the last speakers, but you know, not only is it database, but as I said earlier, developing that knowledge on how to go about learning what works, what doesn't, adjusting your projects and implementing, you know, implementation. I wanted to point to this framework. I wanted to see how much, oh boy. I don't have the clock in front of me, so that was it, and I can't find Lee, so, oh, right there. Oh, great, so out of my range. I can point to this framework, so I am temporally impaired, so this was definitely not the right setup for me. The community change framework, we developed this through GEO, Grant Makers for Effective Organizations, the last couple of years. You will be getting a copy of the final product of this that gets all the details and the measures and stuff. With your resource packet, research list, okay, with that. So you'll be able to have what's behind that and a better explanation that I'm going to give quickly. But I wanted to point to a couple of things here. Here's a framework. What we did is we worked with national funders, with local evaluators, of a whole bunch of slew of different initiatives across the country to look at what they're measuring, because the idea was what you measure is important, right? So we took what they're measuring, we organized it, and then we brought our experience in the research together to create a framework that really kind of shows the process of community change. It comes from a funder's perspective, but I think it has broad use. What I wanted to point to is that there are two levers. The levers of change, the things that we do to create sustainable, scalable change, okay, is on the lower level. And at the upper level are those exact changes, the baseline conditions, the systems, the environments. A couple of the points I wanted to raise that lead to eventually population impact for everyone in the community, and every community. Capacity building interventions. When we looked at it, very few funders and very few local evaluators looked at what they do to build capacity. They didn't look at the quality of training, technical assistance, institutional relationship building, collaboration development. They didn't look at that capacity, those abilities very much. They looked at how happy everybody was getting together, but that was about it, okay? A little bit now, more and more on social network analysis, but not how well did you build networks and relations. Very important to measure that if you begin to understand this process and to see if you're on track, because this is essentially the theory of change, for community change, as far as we know, that fits best with the literature and the practice nationally. Capacity building outcomes, what are the results of those? Are there more networks? Are there those relationships that everyone talks about? Who has those? Are they just at the individual level? Does your capacity building efforts help you develop the individual, the organizational, as well as the cross-organizational relationships, the multiple levels that constitute community change? I mentioned a bit about sustainability as another aspect of it. Sustainability, again, do institutional policies change on the long run? Okay, are the behaviors, do they penetrate? One of the things I point to in sustainability is the notion of penetration. Yes, if you interview all the executives and the people who are attending your meetings, they're going to say everything is better. If you say ask the middle level people in your organization how it is, they're going to say, I've heard a bit about it. If you ask the line staff, often they're clueless. So one of the evaluation challenges in looking at sustainability is looking at penetration as well as funding, as well as whether or not the institutional policies are practiced differently by virtue of that. Next to lastly, I would just point at the importance of looking at the implementation of science work and evaluation to say that it's not done with all this other stuff, but does it change how you implement it? Because learning how to go better is that ongoing learning process of strategy implementation that is very important. Lastly, I will say this, that a word or two on design, because I think it's real important regardless of time. Traditional experimental and quasi-experimental designs are not the gold standard. Science doesn't support it. I have gotten a lot of work over the years explaining why these experimental designs didn't work and have to. I liken my work to Mr. Wolf in Pulp Fiction, where I've had to come and call on a Sunday having to clean up the head blown up in the back of the seat because they did an experimental design because O&B says it, and yet they found nothing because it doesn't match community change. There are other designs, okay, other appropriate designs. That rigor is scientifically principled, not rigid. It's based on principles, and there are alternatives. No, I shouldn't say alternatives, it sounds secondary. There are equally valid methods, okay, that meet the issues of causation, counterfactuals, that don't require a rigid and a practically impossible design. You can spend all the time you want finding Spartanburg's comparison city. There is no comparison city. Unlike people, we are not cities and communities are not 99.9% identical. They have the unique histories and situations, and so we have to come up with other designs for that. Other methods include cross-case study and regression continuity designs. It's just some examples of that. There are, there's a book on many others that we need to develop more, and that standards should be adapted, not lowered, because people deserve that. So I would say, lastly, I quote myself, it is not easy. It's important to know that. We need to start with ourselves and be the change we want to be, to quote Margaret Mead on that. A lot of it is that we have to realize that with community change comes conflict, that the first law of physics is that, where there's change, there's friction. And so we can't have it easy. It's not going to be easy to be able to deal with justice issues and access, okay? So it is difficult, but I like to end with this quote with Martin Luther King, because I do think what we do is critical to social justice, that people deserve the best, that evaluation plays a important role, as knowledge does, in justice, to say if you can't fly, then run. We got to start. If you can't run, then walk, and if you cannot walk, then crawl. But whatever you do, you have to keep on moving forward. Thank you. Sorry.